the world is once again facing a global health emergency. The World Health Organization, or WHO, has declared the M-POCS virus outbreak a public health emergency of international concern, also known as PHEIC. This decision was made due to the rapid spread of the virus across multiple continents. M-POCS, formerly known as monkeypox, poses a significant threat to global health. This outbreak demands immediate attention and a coordinated global response to prevent further spread and mitigate its impact. The situation is evolving rapidly. Health authorities worldwide are working diligently to track and contain the virus. However, the declaration of a PHEIC underscores the seriousness of this outbreak. It serves as a call to action for all nations to collaborate and implement effective public health measures. The WHO's declaration is a clear signal that the M-POCS outbreak has the potential to escalate into a full-blown pandemic. It is crucial to understand the virus, its modes of transmission, and the symptoms it causes to effectively combat its spread. M-POCS is a viral disease that has been known to the scientific community for several decades. The virus was first discovered in 1958 during an outbreak among laboratory monkeys. This is where it got its original name, monkeypox. However, it is important to note that the virus is not limited to monkeys. The first human case of M-POCS was not recorded until 1970. This initial case occurred in the Democratic Republic of Congo, a region in Central Africa where the virus is considered to be endemic. Since then, sporadic outbreaks have been reported in several other Central and West African countries. The M-POCS virus belongs to the orthopox virus genus, which also includes the variola virus, the causative agent of smallpox. While M-POCS is less contagious and less deadly than smallpox, it can still cause serious illness. Understanding the history and origins of M-POCS is crucial to developing effective prevention and control measures. By studying past outbreaks, scientists can gain valuable insights into the virus's behavior and transmission patterns. M-POCS transmission can occur through various routes, both from animals to humans and between humans. Close contact with infected animals or individuals is the primary mode of transmission. This contact can include bites, scratches, or handling of infected animals. Human-to-human transmission primarily occurs through respiratory droplets, direct contact with bodily fluids, or contact with contaminated materials such as bedding or clothing. It is important to note that M-POCS is not considered to be as easily transmissible as some other viruses, such as measles or influenza. The virus can also be spread through contact with the lesions or scabs that develop on the skin of infected individuals. These lesions contain a high viral load, making them highly contagious. Understanding the different routes of transmission is essential for implementing effective infection control measures. These measures may include isolation of infected individuals, contact tracing, and the use of personal protective equipment or PPE in healthcare settings. M-POCS presents with a range of symptoms that vary in severity. The incubation period is usually between 6 and 13 days. Initial symptoms often resemble influenza. Early symptoms include fever, headache, muscle aches, and chills. 1 to 3 days after fever, a distinctive rash develops. The rash begins on the face and spreads to the body. It progresses from red spots to raised bumps. These bumps become pustules, then scab over and fall off. Seek medical attention if you develop symptoms, especially after exposure. Section 5. The current outbreak. A growing global concern. The current M-POCS outbreak has raised significant concern within the global health community. The virus has spread to multiple countries across Africa, Europe, North America, and other regions. The number of confirmed cases continues to rise, and the geographical spread of the virus is a cause for alarm. While the majority of cases have been reported in countries where M-POCS is not endemic, the virus has also been detected in several Central and West African countries. This highlights the potential for the virus to spread rapidly and establish itself in new populations. The WHO is closely monitoring the situation and providing guidance to affected countries. However, the outbreak has exposed vulnerabilities in global health systems and the need for enhanced surveillance and response capabilities. The international community must work together to contain the outbreak, provide support to affected countries, and strengthen global health security to prevent future outbreaks. Section 6. Echoes of Outbreaks Past. Lessons from 2003. The current M-POCS outbreak has drawn comparisons to the 2003 outbreak in the United States. This outbreak, which was linked to imported rodents from Africa, resulted in 47 confirmed and probable cases of M-POCS. While the 2003 outbreak was relatively small and contained, it served as a reminder of the potential for zoonotic diseases to emerge and spread rapidly. It also highlighted the importance of effective surveillance, rapid response, and public health education. The lessons learned from the 2003 outbreak, including the importance of contact tracing, isolation of infected individuals, and vaccination of at-risk populations, are being applied to the current outbreak. However, the current outbreak is more widespread and presents unique challenges, including the need for international collaboration and the potential for the virus to establish itself in new animal reservoirs. Section 7. Combating the outbreak. Strategies for control. Controlling the current M-POCS outbreak requires a multifaceted approach that involves a combination of public health measures, medical interventions, and community engagement. One of the key strategies for controlling the outbreak is early detection and isolation of cases. This involves identifying infected individuals as quickly as possible and isolating them to prevent further transmission. Contact tracing is another crucial aspect of outbreak control, as it allows health officials to identify and monitor individuals who may have been exposed to the virus. Vaccination is also an important tool in the fight against M-POCS. While there is no specific vaccine for M-POCS, the smallpox vaccine has been shown to provide some protection against the virus. In addition to these measures, public health education campaigns are essential for raising awareness about the virus, its modes of transmission, and the steps that individuals can take to protect themselves. Public awareness, a crucial line of defense. Public awareness and understanding of M-POCS are crucial for preventing further spread. When people are well informed, they are better equipped to take necessary precautions. Campaigns should focus on accurate information through various channels. Emphasize seeking medical attention if symptoms arise. Promoting preventive measures is paramount. Regular hand washing or using alcohol-based sanitizers is crucial. Avoid close contact with sick individuals. Educate about the risks of contact with wild animals. Avoid handling or consuming bushmeat. Section 9. Global Preparedness, a shared responsibility. The M-POCS outbreak highlights the interconnected nature of global health. It underscores the importance of international cooperation and preparedness. No country is immune to infectious diseases. A coordinated global effort is essential. Strengthening global health security requires investment in surveillance, labs, and public health infrastructure. Partnerships between countries facilitate sharing information, expertise, and resources. Early detection and rapid response are crucial in containing outbreaks. Section 10. Conclusion. Navigating the path forward. The M-POCS outbreak presents a significant challenge to global health, but it also offers an opportunity to strengthen our collective response to infectious diseases. By learning from past outbreaks, implementing effective public health measures, and fostering international collaboration, we can work towards containing the current outbreak and preventing future ones. Public awareness, education, and engagement are paramount in curbing the spread of the virus. Individuals must be empowered with accurate information and encouraged to adopt preventive measures to protect themselves and their communities. The path forward requires a sustained commitment from governments, health organizations, and individuals alike. By working together, we can navigate this challenging situation and build a more resilient global health system that is better equipped to handle future health emergencies.